Hello, friends. Thank you for joining us today. I will tell you that I have missed having the opportunity to come to you on Facebook Live and give you an update on where we find ourselves. Obviously, this has been a particularly difficult week for me and for my family. Not only are we seeing significantly higher numbers of cases in our state, and by the way, every other state, I'll give you an update on that coming up. But we did have a situation in which, after testing negative for the virus on Monday, my youngest did test positive on Tuesday. We've had a lot of different people across the state that have been testing positive over the last couple of weeks. Sort of what I look at as the post-Halloween increase in number of cases. I do want to give you a brief update that Maddie is recovering well. She is feeling okay. She is certainly, along with her mom and dad, are very grateful for all of your prayers. We feel them, and we want you to continue praying for us. That's really important to my family. We have prayed for our leaders across the nation and across this state, Republicans and Democrats, folks from the Hill Country to the Gulf Coast and everywhere in between. We want to continue to pray for everyone in these challenging times. I'll also tell you that because we had a potential exposure for my two oldest girls as well last Wednesday. My two oldest have basically been in self-isolation by and large since the middle of last week. Fortunately, each of them have tested at least 4 times and so far tested negative. Ely and I both have been tested multiple times over the last 7 days, continue to test negative. But we're going to continue to take the necessary precautions. In fact, we are doing everything we can to make sure that each of them are protected and isolated, and we know that so many of you are out there doing the same things, and we want to thank you from the bottom of our hearts for everything that you're doing, because with this virus, it treats different people so very differently. While many of our young people have less symptoms, if the virus is then spread to folks over the age of 65, it's a really difficult thing, particularly if you have a comorbidity or maybe 2. It can really do significant damage, and obviously with over 3,000 fatalities during the entire year of 2020, it can obviously have very dire outcomes. And so, again, we want to thank you for praying for us. When we look at what's going on in the state of Mississippi, and I do have my phone with me, I've seen where some of you criticize me because you think when I look at my phone during press conferences, that I'm checking text messages. Well, in reality, I keep my web server on the State Department of Health's website because I get constant updates on the total number of cases and hospitalizations and other things. But what we're seeing in our state today is that we had approximately 1,271 new cases reported today. That's after yesterday having approximately more than 1,250 cases. That's a 2-day total of 2,500 cases. It's significantly more than what we had become accustomed to during the late month of August and September and October. To put it in perspective, I yesterday went and looked at the data. Of the 30 states that have the most total cases throughout the pandemic, Mississippi, of those 30 states, and Mississippi is ranked 28th, by the way, in that number today. Mississippi actually had less cases than all the other 29 states out there yesterday. And so I say that not to do anything other than to put things in perspective. What we're seeing now is a significant uptick in cases across the country in virtually every state, some of whom have taken significant measures, some of whom have taken less significant measures to address it. And so we are seeing a pretty significant uptick across the board. As you'll recall, our total number of hospitalized patients at our peak back on and around July 26 was 1,250 people in the hospital bed. Today we have 669, or actually yesterday we had 669 confirmed patients with COVID, and approximately 87 patients that are suspected to have the illness. So, a little over 750, which again is about 60% of where we found ourselves at our peak. But it is a pretty steady, significant uptick in total number of hospitalized patients, which is what we would anticipate. Because of that, we do find ourselves where we are seeing more and more challenges within our healthcare system. We want to remember that our goal is not to completely eradicate the virus or eliminate the virus, because that's not a realistic goal. Our goal is to make sure that every single Mississippian that can get better with quality care receives that quality care. And to do that, we've got to protect the integrity of our healthcare system. And as the numbers tick up, it gets increasingly more challenging to do so. So we're monitoring that very, very closely. That is also the reason that I did sign an executive order earlier this week. I do apologize. We had planned to do a press briefing with Dr. Dobbs and his team on Tuesday at 2:30. And unfortunately, between the time that we announced that and the 2:30 time frame, we did have to deal with the positive case with our own family. But in that latest executive order, we extended the order in terms of county by county recommendations and county by county mandates. We reset the counties where masks are required. Those counties, based upon and a very objective criteria. Keep in mind, if you have more than 200 cases over a 2-week period, including more than 200 per 100,000 residents over that 2-week period, which in essence means that you're in the red zone from President Trump's White House recommendations, or if you have over 500 cases per 100,000 residents, you go on the list, and there is no fudging of the data. There is no fudging of the numbers. It is what it is. If you are on the list based upon our criteria, which by the way has not changed since we started having county by county mask mandates way back in June. The counties that currently meet that particular objective criteria are as follows: Benton, Carroll, Covington, DeSoto, Forest, Harrison, Humphreys, Jackson, Lamar, Lauderdale, LaFleur, Lee, Marshall, Rankin, and Yalobusha counties. Those are the 15 counties that currently have additional restrictions that have mask mandates. There have been some that have been on over the last month or so that have fallen off because those individuals in those counties really worked hard, made the sacrifice, made sure that they were wearing masks in public places, and that they were aware and recognized what they needed to do. And I'm certainly very, very proud of them. One of the counties that there's been a lot of discussion about, as I appreciate it, is the county of DeSoto up in the north part of our state, one of our great counties just south of the Tennessee-Mississippi line. Several people and several close friends of mine in the area have reached out and wanted to talk about DeSoto County, and particularly in lieu of the fact that it is a county that over the 2-week period of the data that we looked at had more positive cases than any other county in the state. In fact, over that 2-week period, DeSoto had 901 cases. Just to put that in perspective, I did a little bit of research and a little math. If you look at Hinds, Rankin, and Madison counties combined, there are 493,000 people in Hinds, Rankin, and Madison County in Mississippi. In DeSoto County, there's approximately 184,000 people. Over the same 2-week period, Hinds, Rankin, and Madison had a little over 970 total cases. Meanwhile, DeSoto, with approximately 1/3 the population, had 901 cases. And so when you look at that it's very obvious that that is a county that we're very concerned about. We want to strongly encourage our friends and neighbors in DeSoto County that if you go in public, wear a mask. Think about not only yourself but your friends and your neighbors and your kids and your grandkids and your moms and your dads and your grandmoms and your granddads. Because if we work together, we can truly slow the spread of this virus. There is nothing that we can do that is foolproof. There is nothing that we can do, no mitigation measures that we can do that guarantees the elimination of the virus. And so what we're talking about is trying to attack it in a number of different ways while we do not allow for the shutdown of our economy, but that we do the little things which can slow the virus at the margin, which can help protect the integrity of our healthcare system. We had some incredible news on this Monday from one of the companies that is doing vaccine trials. I think it's incredible that they have now projected that the first vaccine that comes out in trials has been over 90% effective. That's incredibly good news. And I will tell you, I don't think anybody ought to start trying to play politics with that. There is no doubt that when the president and the vice president put in place and implemented Operation Warp Speed, put the American taxpayers at risk in helping fund the research as was necessary to find these vaccines, it's making a difference. And for some of my colleagues, particularly my Democrat colleagues around this country, to claim that they want to delay distribution of this vaccine that can potentially save lives, it's not the right time to play politics. That's just a fact. Let's focus on getting people well, protecting people, particularly protecting the most vulnerable. And if we're successful at doing that, then we can make a real difference. You know, one of the things that I wanted to address also before I let you get back to work is there's been a lot of discussion in lieu of the most recent presidential election, which, by the way, I want to commend all of our circuit clerks around Mississippi, all of our volunteer workers in every poll location. As I had been promising for weeks and weeks and months, we can have a safe election even during the COVID pandemic if everyone will wear a mask. I was so pleased. I went to a new precinct where I vote now. I had to change my registration. I did so several months ago. But in my new precinct that I went to, I had to sit in line for approximately an hour and 15 minutes. But every single person that was in line had a smile on their face. Every single one of them wore a mask. Every single one of them were excited about exercising their responsibility and their constitutional rights as Americans. I know that we didn't all vote for the same person. We don't all have the same political views, but I was very proud of every single Mississippian that was in line that day, and I was very proud of the over 1 million Mississippians who went to the polls and voted on election day, and I'm very pleased that we were able to maintain a safe and a secure election. But I've been asked that if the legal challenges that are currently being contemplated play out and the former vice president ultimately becomes the next president, then what is going to change? And what I will tell you is, even based upon some of the things that I have heard and said from his campaign, I will tell you, I don't think much of anything is going to change with respect to the virus. The fact is that we're going to try to work with whomever the president is, but we're not going to participate in a nationwide lockdown. This notion that one of his advisors has said that all we really need is about a 6-week national lockdown and we can slow down the spread of this virus is totally and completely beyond reasonableness. The people of Mississippi can't just go home, shut down their small businesses, shut down their restaurants, shut down their gyms, shut down other small businesses for 6 weeks and just think that you can come back 6 weeks from now, flip a switch, and everything's going to be fine. It's not the way the economy works. And so we believe that while they may make recommendations that in this country under the Stafford Act, when you have emergencies, and this is clearly one of the longest lasting emergencies in American history, that those emergencies have to be state managed, locally executed, and federally supported. And so while I don't believe that there's any constitutional or statutory authority for any president to shut down Mississippi's economy, we will certainly fight that if it becomes necessary. We as a state are going to continue with our strategy. It's got to be targeted to those counties where the number of cases are much greater than other areas across the state. It does us no great good to shut down counties just so we can go on Facebook Live or national TV or otherwise and say, hey, look at us, we've been shutting things down. We're trying to open things up, but to do it in a safe, responsible way. We're not going to shut down businesses. We're not going to have long-term mandates with no end in sight. We're going to be transparent. We're going to talk to you, the people of Mississippi, when we have additional restrictions that are put in place. We're going to tell you where we're doing it, why we're doing it, and what we're trying to accomplish by doing it. Before I leave you today, I do want to just mention the very exciting news that was announced earlier today in Madison County, Mississippi. I was scheduled to be there. I was unable to do so, but we did announce, working with the local governments in Madison County, that Amazon is coming to Madison County and bringing 1,000 jobs with them. This is a huge capital investment in our state. It's a company that has made the decision and understands our workforce development, workforce training, and quite frankly understands the quality of the Mississippi worker. And I am so pleased that Amazon has made this decision. It just shows that even during COVID, our economic development team in Mississippi is working to bring better, higher paying jobs to our state. And I am so pleased and so proud that Amazon has made this decision. This is going to hopefully continue to spur more economic growth just north of our capital city. And I feel certain it's going to create opportunities for people all across this great state. So again, I want to thank everyone. Please continue praying for us. Please continue praying for all of your leaders across this nation. I am continue to be very, very optimistic about the future of our state, because more and more employers are seeing the value and seeing what it means to live in a place like Mississippi. I'm proud to be a Mississippian. I'm proud to be working with our local leaders, to be working with all of you to make Mississippi an even better place. So thank you for all that you do. Please stay safe out there. Maintain social distancing. Stay in small groups. Continue to wear a mask when in public, particularly when indoors. And working together, we're going to continue to do better tomorrow than we did the day before. So thank you, and God bless.